Colin, thanks for that talk. It's really interesting. Now, we have a lot of questions coming in and we're not going to be able to answer them all, but we'll endeavour, as I said before, to get through as many as we can. So first question's from Olivia. Olivia, Colin, how influential do you think REDS has in the occurrence of running injuries? What is the management pathway you follow if you suspect this?
Yeah, a good question actually, and quite a common one, particularly for probably for younger athletes. And so if any parents of adolescent athletes, doesn't have to be adolescent actually, but it can be, you know, adults too, or coaches. So REDS, for anyone who doesn't understand it, is relative energy deficiency syndrome. So quite common in female athletes, I'd say mid to late adolescent, even into early adulthood. And we would see a lot of them who have like recurrent stress fractures. So metabolism is a big factor. So definitely we would look at energy deficits. Are they getting enough calorie intake at the right time around training, or are they in a constant state of depletion? You know, looking at like hormonal profile, have they got a regular menstrual cycle? And even just looking at psychosocial factors as well. You know, are they more conscious of their body type and body shape? So with those type of athletes or runners, we would probably have to have a bit more of a holistic approach here. If it's young athletes, we want to try and involve the parents and the coach to make sure they're all on the same page in terms of how to manage them. They may need nutritionist and psychologist intervention as well. But as I said, it's not just limited to female athletes. Male athletes can be energy deficient, can have recurrent stress fractures as well. So we would certainly be on the lookout for that. And if we suspect that's a factor, we would definitely push the nutrition side of things, careful load management, and making sure that they have a good SSC program, a good balanced running program that suits their needs.
Thank you. There's a question here actually. Can stress fractures in shins take a long time to heal? I haven't run in 6 weeks. I've been told I have a grade 3 stress fracture. What am I doing wrong? I walk, cycle, swim. Could this be delaying my recovery?
Yes, grade 3 can take a bit longer to heal. Like a standard sort of lower grade stress fracture, you're talking 6 weeks, and probably trying to immobilize for a good bit of that as well to allow for early bone healing and remodeling to take place. Yeah. And then you want to get back, you know, once that healing has taken place, you know, you want to try and get back into a gradual exercise program. So get back walking first, be fairly pain-free and have no sort of gait abnormality, then get back into some strengthening exercises, because there will be some muscle wastage if you're in the boot for a while and you're not using those calf muscles and ankle muscles and foot muscles. So definitely want to recondition those. And then you want the body to be able to tolerate some little bit of low level impact. So like doing things like hopping, skipping is a good bone stimulus. Just short 30-second bouts, you know, maybe once or twice a day, is a good bone stimulus, and to be able to tolerate that and then gradually get back running, and then obviously make sure that your energy intake is good, calcium and vitamin D levels are good, and nothing more than a low level of pain or discomfort as you progress through it. Obviously, if there's a worsening or there's a high level of pain that's not getting better, you may want to just maybe get reassessed again and see is there incomplete healing, and does it need maybe a more long-term approach.
Okay, thanks. Joan is saying she has Achilles tendonitis for the past 4 weeks, not getting better. Is there anything she can do to speed up her recovery?
Yeah, so obviously you want to be sure of the diagnosis that is Achilles tendinopathy and nothing else. And I suppose, why is it not, like, I suppose find what can you do that's not too sore, and maybe what is the sticking point, you know, so there's a certain level of exercise that you go above where you're going to be sore. But it's really important to find some level of exercise that you can tolerate, and that'll sort of accelerate tendon adaptation to exercise. So finding some sort of calf raise exercise, if it's just a static isometric hold or a half heel lift position, putting tension on the calf muscles without the tendon being too sore, and trying to progress from that. So again, depending on how long it is, you know, some of our sports med doctors might look at an injection, a high volume saline injection that might help to settle the pain a little bit and allow them to exercise a bit more. They might maybe use something like shockwave. From a nutritional point of view, we tend to encourage people to supplement with collagen and vitamin C, which helps to, I suppose, give the tendon the important nutrients it needs to have to repair itself and remodel. But definitely trying to find a level of exercise that you can tolerate and progress on from there. And sometimes people just can stagnate on the rehab program. You know, they can do maybe things that are maybe too easy. The body gets too used to that, and there's no progression and no added stimulus there. and momentum can be lost. So again, it's very hard to cover everything there when I don't know the full picture, but that would be my sort of general advice.
Yeah, lovely. Sam, what is the prognosis when diagnosed with possible Haglund's deformity, struggling with Achilles problems for 4 years, and there is a bony spur on the right insertion?
Yeah, so that's a tricky one. So so if it's down on the heel, you know, the heel is kind of like a sharp enough bony structure as it is, and if you've got a Haglund's deformity, which is an extra sort of little bit of bone growth, you've got that bone kind of digging into the tendon on one side, and if you're wearing shoes, you've got the heel cup of your shoe digging in on the other side, and that could just keep annoying the tendon over and over again. So if it's not responding to rehab, it's, you know, it's worth getting a surgical opinion on that. So I'd be kind of referring someone to back to maybe our sports med docs, or maybe to a foot and ankle surgeon, just to see is another intervention required, because that might be just that just the nature of it might be just you know, constantly irritating it and maybe stagnating progress.
Yeah. Now, we've had a lot of people coming with this question tonight about what do you think about barefoot type of shoes for running or walking in, and generally what type of shoes? So we'll probably answer a lot of people's questions there.
Yeah, a loaded question. Barefoot type of shoes, to be honest with you, I don't like, it's more the transition. So if you're used to wearing cushioned shoes and all of a sudden you go barefoot or you go minimalist and you don't adjust your training load, you're putting yourself at a huge risk of injury, because your lower limb muscles have to adjust a lot to that. They're going to get tired quicker because they're not used to that. And if you're trying to do the same amount of miles, or you know, or train the same intensity, you're putting yourself at risk of injury. If you're going to do it for whatever reason, you're doing it. There's no necessarily one sort of clear right or wrong here. If you need to do it, just allow a gradual adjustment time. I think it's good to do some exercise in minimalist or even just without shoes, just to try and train the foot a little bit more. But you know, there was a bit of a swing towards minimalist and barefoot maybe in the last 5 to 10 years. It's kind of gone back a bit more. If you look at all the new shoe technology in races, they're going back to more towards cushion shoe with special sort of spring cushioning in them along with the carbon fiber plate. So to be honest with you, I try not to break a formula that's working for you already, unless you've got a very good reason to do it. And I don't know your full history to be able to give you a very precise answer on that.
Thanks. Kevin, lots of calf muscle strains generally at the moment. What's causing this, and how long to rest for?
Yeah, probably the simple answer there, given we've seen in the last few months, is you probably have weak calves and trying to ask the calves to do more than they're able to give you when you're trying to run at a certain level. So improving, go back to what I said in the talk there, you know, trying to increase calf capacity, because they're so important for running. We demand a lot of them when we're running, and if the capacity is low, it takes a lot less for them to get tired, to get sore, to get spasmed, and for an injury to occur. So load up calf strength, find a manageable level of running that you can tolerate, and then try to increase gradually from there. You know, that would be probably again, without knowing the full picture, that would be my best advice there.
Yeah. Alan says he's got a pain in the space between his Achilles and ankle, originally thought to be Achilles tendonitis. Issue did not resolve with conservative strength exercises. MRI of the ankle was unremarkable. Issue now suspected posterior ankle impingement. Is Corson shot best option from here? Yeah,
that's not my decision. I suppose the clinical test you can do that can differentiate between an Achilles tendinopathy and having a posterior ankle impingement. So if you're quite sore, if you put someone lying on the front, bend their knee, and you try to force them into end range plantar flexion, so you're trying to kind of squash the ankle, bring the heel as close to the top of the ankle as possible. And if they're sore doing that, and you give the heel a few taps and it's quite sensitive, there's a good suspicion that it is a posterior ankle impingement. Quite common in dancers who spend a lot of time on their toes in those kind of heel raised positions. It can be managed conservatively, so we do see a lot of them, and if you can prove how you control the ankle. So people who are hypermobile have a lot of space to move, a lot more room for bone-on-bone contact. That can be managed by being more stable to the ankle, being stronger in the calves in those sort of heel raised positions. And if not, then yes, we're getting a sports med doc to have a look at and see if an injection might help to settle things down a little bit.
Okay. Anne-Marie said, will running on grass reduce forces on the lower legs, and will this have a notable reduction in the risk of injury?
Yeah, so it goes back to the shoe, changing shoes as well. It's what you're used to. If you're used to running on road and you go on grass, it can be a bigger stress in the body as doing the opposite. So, and you know, softer is not always better. When you run on softer surfaces, your muscles have to contract a lot more. And if the surface is quite soft, particularly grass in, say, winter and springtime, you're going to be on the ground a little bit longer. So muscles have to work that a little bit harder. And if they're not used to it, they're going to get tired a lot quicker. Whereas on the roads, you can use your natural spring system better. You can use the tendons a lot more, and they can save the muscle work. So there's pros and cons. I think it's good to, personally, I actually hate running on the grass, but that's my own personal opinion. I wouldn't force it on anyone else. Yeah. Well, I think it's a good idea to mix it up, do some runs, be off the road, do some runs on the road. And even just doing some off-road running can actually help just to improve, I suppose, strength and stability around the foot and ankle complex. So the force going through the body is actually the same. It's just how you coordinate around the joints, around the ankle, knee, and hip can differ.
Okay. Jonathan, what is the right rest period for shin splints from running? I have this from early May. I'm nervous to start running again as I don't want to prolong injury time frame being any longer. Yeah, so again, a few things in that. A shin splints, so it's kind of pain on the lower inside of your shin. And I suppose it's on the spectrum of a stress fracture. So it's like an early stage sort of bone stress response. We're struggling to heal and adapt to what you're asking to do. So there's no set time frame. If it's shin splints and it's a low level of discomfort, some people can run through it, just adjust their training, maybe space out the runs a little bit more. But I would definitely be looking at running mechanics. I would be looking at your running load, making sure there's enough recovery time in there, staying below a threshold of running that you can tolerate that doesn't cause pain or cause a worsening of it. Make sure calf strength is good, because again, it comes down to those bone bending forces. And if the inside calf muscles and the deep calf muscles aren't strong enough to cope with that, it's going to be a lot more fatigue in the muscles and a lot more loading going to the bone. So make sure that's addressed. And then it's a question of trying to progress back up again. You know, you want to be able to, so for some, say like if someone has a muscle injury or a tendon injury, we can probably let them train with a level of pain that might be like a 4 out of 10 on a scale. But for a bony type of injury, like shin splints, maybe a little bit less than that, maybe like a 1 or 2 out of 10 that doesn't worsen. And the main thing is you can increase your running, and whether it's volume, whether it's intensity or frequency, without worsening in symptoms. So it's very hard to give a proper time frame. And also important then, as I mentioned in one of the other questions, is to look at nutrition and look at energy intake, and to make sure there's good recovery and you're in good metabolic health to be able to adapt to what you're asking to do. One last question here from Gillian. Gillian said she's an ongoing battle with gluteal tendonitis. She's done full rehab, had running analysed. One issue was that she doesn't lift her knees enough, which causes her hips to drop when she strikes the ground. Is the only way forward to continue to try and change her gait? It's one way forward, and it's important to look at that. So again, as I mentioned there in the presentation, the example of a hip drop that causes compression of the glute tendon against the bone. So if that's happening every stride, just the tendon is going to be constantly annoyed because there's extra compression. So the base of the tendon is getting sort of compressed, squashed against the bone. Definitely important to look at strength around the hip muscles and that as well. So there's a few questions there. People saying I've tried rehab but haven't worked. It's like there's different ways of rehabbing. It's like saying I've tried running but I haven't got any fit or haven't improved my PB, so running isn't for me. Or I need to do something else. But just maybe the way you went about it might be the right way for you. And that's not criticizing anybody else or that. People do things with the best of intentions and under their but you may need to try in a different approach. And you need to maybe get a proper assessment of your strengths and have numbers there that gives you, I suppose, an objective measure where you're at, and then try and chase it. Do a program and try and make sure that you're getting changes in those outcome measures. And if you are looking at running gait, it's grand someone telling you're not lifting your knees enough. Again, I think that's the biggest issue, but the hip drop is one to look at, and you want to make sure you're doing something to maybe modify that a little bit. You mightn't be perfect, but you can maybe reduce that a little bit, and that might take a little bit of load off the glute tendon. But it's really important to have strong hip muscles, and also make sure the level of running you're trying to do is manageable for you, for your individual needs. Lovely. Thanks, Colin, for joining us tonight. And thanks to everybody that's joined in. We will be sending an evaluation out. We'll be back in the autumn with our next series of public talks. So if you want to go on the website, they'll be on there towards the beginning of August. Enjoy the rest of your summer, and thank you.